Okay, guys. Yeah, I'm John. I own Dermagrow Solutions, and I thought I'd make a video about preventative measures and treatments you can do for non-melanoma skin cancers, which are kind of an epidemic right now, like basal cell carcinoma and squamous cell carcinoma, various hybrids in between the two, and yeah, it's a super common for people with fair skin, like Fitzpatrick 1 and 2. And as it is right now, the main treatment is surgical excision. They do like a wide margin excision or Mohs microscopic surgery. And so today I'm just going to explore the research about some other effective treatments and preventative measures you can take to protect yourself from getting any more non-melanoma skin cancer in the future. So with that, let's go to the blog post that I've written, which I'll link in the video description, and I'll have all the sources cited as well. Okay. Okay, yes. So here is the blog post that I wrote, and headline: Innovative Approaches to Preventing and Treating Non-Melanoma Skin Cancers. The primary treatment is surgical excision, and just the downfalls with this is one, there can be wait times of months to go before a doctor just to get the biopsy, and another several month waiting period to get the surgery scheduled, and then maybe they don't get clear margins, so there's the potential that the NMSC could metastasize. So, and then secondary concern is scarring and deformation. This is super common. I mean, often they'll bring in a plastic surgeon to minimize that, but people still end up with quite significant scars. And then reoccurrence. Basically, if you get diagnosed with a basal cell or squamous cell carcinoma, there's a very high likelihood that you'll get more down the road, whether in the same spot or in other areas. And then lastly, it's not addressing the root cause, which is the UV damage, the photo damage that's harmed the DNA in your skin. So if you have photo damage on your face from sunburns when you were a kid or throughout your life, then that's going to be a reoccurring issue, and that's why these NMSCs generally resurface. So let's go into some effective treatments, and I'm starting with the treatments and the preventative measures that have been documented in human studies, that have shown efficacy in human studies. So the first one is absorbic acid, vitamin C. There's been several studies on this, but I cite one here where they made a solution, 30% vitamin C and DMSO. This kind of helps penetrate deep into the skin, into the dermis. And in this study, there was a nearly 90% cure rate for the BCCs in just 8 weeks. And this outperformed the imiquimod treatment, which is a common thing, a cream they use on superficial BCCs. And it worked better, it didn't have the side effects, and didn't irritate the surrounding healthy skin. So that's a good one if you're months out from an appointment. That's the treatment to consider using. And then let's see, number 2, bromelain. This is something that's extracted from pineapples. It's an enzyme, and they've formulated it into a concentrate that's a drug now called Nexobrid. And there's just one study about this, but it had a 100% cure rate for all the BCCs in the study. So super effective. That one does require a prescription, so that's certainly worth looking into. Okay, now going into preventative interventions to protect yourself from more NMSCs in the future. Caffeine. Caffeine is probably, as far as easily available over-the-counter preventative measures, this one's a no-brainer. One study showed that people consuming 400 milligrams of caffeine a day, so roughly 4 cups of coffee or tea, had a 41% reduced risk in NMSCs. And then in a mice study, they applied it topically, and it reduced the malignant tumor count by 72%. So mice study, but still, you combine that with the human studies around oral consumption. It's something very much worth looking into. And also, topical caffeine has skin benefits, anti-aging benefits. It makes your skin tighter and less puffy. So I think that one's a no-brainer. Moving on to number 4, nicotinamide. Nicotinamide is quite commonly, suggested by dermatologists to reduce your chance of more MSCs in the future. And there's been numerous studies and large studies in humans. If you take nicotinamide twice a day, 500 milligrams, it reduces your chance of new NMSC formation by 23%. So quite a significant reduction. They haven't done these studies applied topically as far as protecting against non-melanoma skin cancer, but it's very widely used in skincare as an anti-aging topical. It restores a skin barrier, reduces signs of aging and hyperpigmentation, dark sunspots and so forth. So again, that one's a no-brainer. It's a vitamin B3 derivative. It's healthy for you. It's anti-inflammatory, so everybody should be taking that, especially if you've had an NMSC diagnosis. Moving on to number 5, EGCG. This is a catechin that's in green tea. When consumed orally, it has a ton of benefits. It's good for your heart, cardiovascular system. It helps you burn fat. And then applied topically, it's been shown in mice studies to reduce malignant tumors by up to 66%. So I think given the numerous health benefits, you should at least be taking that orally. It cannot hurt. And then the next one is silymarin. This is something that's extracted from milk thistle, and it's very common in herbal medicine to give milk thistle extract. It's primarily used for your liver health, but there are other benefits as well. And then in my studies, when they applied it topically, it reduced the new incidence of NMSC tumors by 75%. So I think that's another good one to incorporate into your daily routine. Then number 7 is grapeseed extract. There are components in grapeseed or grapeseed extract that have been shown to curb photocarcinogenesis. This is like the formation of tumors due to UV damage, and reduce their incidence by 95% when incorporated in the diet of mice in studies. So that one is apparently quite a potent one. Again, it's a mice study, not a human study, but mice are chosen because their DNA is quite similar to humans. So, and then interesting to know, just in that same study, it was like over a 20% reduction in fat mass. So their body fat percentage went down consuming the grapeseed extract. All right, then moving on to number 8, curcumin. This is a derivative from the turmeric plant, the root specifically. And in my studies, when they incorporated curcumin into the diet, it significantly curbed the occurrence of NMSCs. I wasn't actually able to find the exact percentage reduction, but they just said it was statistically significant. But curcumin is, a widely taken health supplement. It's a very potent anti-inflammatory. It's neuroprotective. It's good for your heart. So I think that's another sensible addition to your daily routine as well. And then last but not least, we have rapamycin, also known as sirolimus. A very interesting compound. It's like bacteria derived. I think they found it on Easter Island, and it's a prescription drug. They use it to help post organ transplant patients, and it helps with rejection. It's like an immune system modulator, and anyhow, in a meta-analysis, so a review of a bunch of studies involving almost 6,000 patients, sirolimus led to a 56% reduction in new NMSC formation. So this could very well be the most powerful prophylactic or preventative measure we have against non-melanoma skin cancer. What's more, it's an mTOR inhibitor, and so it's become quite a popular addition in like longevity protocols because inhibiting mTOR is theorized to protect people from a lot of old age diseases. So again, it's a prescription drug, so you need to go to a doctor for that. And the study was about kidney transplant patients, so we need to replicate that in a healthy population to truly get actionable data from that. But that one looks extremely promising. So yeah, guys, that's the bulk of the research. I just went through tons of studies to find these, and I'll link the blog post and the references in the video. So that's it. All right, later.